नमस्ते बिटिया हमेशा खुश रहो बिटिया I am Dr. Bharat Sharma, Assistant Professor, Department of Pathology, Faculty of Homeopathic Science, JAYOTI VIDYAPEETH, Women's University, Jaipur. Today's topic is encephalitis. Now, parenchymal infection of the brain is termed encephalitis. Encephalitis may be result of bacterial, viral, fungal, or protozoal infections. Now, first is bacterial encephalitis. Bacterial infection of the brain substance is usually secondary to involvement of meninges rather than a primary bacterial parenchymal infection. This results in bacterial cerebritis that progresses to the brain abscess. Now, brain abscess may arise by one of the following routes. First is by direct implantation of organism. Examples are following compound fracture of the skull. Second is by local extension of infections. Examples is chronic suppurative otitis media, mastoiditis, and sinusitis. Third is by hematogenous spread. Examples are from primary infection in the heart, such as acute bacterial endocarditis, and from lungs, such as in bronchiectasis. Clinically, there is usually evidence of reactivation of infection at primary site preceding the onset of cerebral symptoms. Gross appearance, it appears as a localized area of inflammatory necrosis and edema surrounded by fibrous capsule. Microscopic examination shows the changes consist of liquefactive necrosis in the center of the abscess containing pus. It is surrounded by acute and chronic inflammatory cells, neovascularization, edema, septic thrombosis of vessels, fibrous encapsulation, and zone of gliosis. The CSF and overlying meninges also shows evidence of acute and chronic inflammation. Now, second is tuberculoma. Tuberculoma is an intracranial mass occurring secondary to dissemination of tuberculosis elsewhere in the body. Gross appearance, it has a central area of caseation necrosis surrounded by fibrous capsule. And microscopic examination, there is typical tuberculous granulomatous reaction around the central caseation on necrosis. A zone of gliosis generally surrounded the tuberculoma. Advanced cases may show area of calcification. Third is neurosyphilis. Syphilitic lesion of the central nervous system used to be common and serious, but more recently there is evidence of a typical neurosyphilis in cases of HIV and AIDS. The lesions in syphilis may be in the form of syphilitic meningitis, found in secondary syphilis, and neurosyphilis consisting of Tapes dorsalis, and generalized paralysis of the insane occurring in tertiary stage. Now, second is viral encephalitis. A number of viruses can infect the CNS and produce either aseptic meningitis or viral encephalitis. But sometimes combination of both termed meningoencephalitis is present. Most viral infection of the CNS are the end result of preceding infection in other tissue and organs. Most of the virus reach the nervous system by bloodstream before they which they enter the body by various routes. Examples are infection of the skin and mucous membrane in herpes simplex virus and herpes zoster varicella, by the alimentary tract in enterovirus including poliovirus, by arthropods bite in arbovirus, by transplacental reaction in cytomegalovirus, and through body fluids in AIDS in HIV infection. Rabies virus travels along the peripheral nerves to reach the central nervous system. Herpes zoster varicella is a distinct primary disease chickenpox, but the virus remains latent for a long time before it gets reactivated. Slow virus diseases are another group of central nervous system infections in which the agent have not only a long latent period, but the disease also develops slowly and may produce subacute sclerosing panencephalitis, progressive multifocal leukoencephalopathy, progressive rubella panencephalopathy, and subacute spongiform encephalopathy. HIV encephalopathy, its dementia complex. Next to knocking off the immune system, HIV has profound neurovirulence, but unlike tropism for CD4 plus T cells of the immune system, HIV does not have neurotropism. HIV has not been identified to infect the neuronal cells, but instead infect the cell of monocyte macrophages cells line including microglial cells. Late in the course of AIDS, a group of signs and symptoms of CNS disease appears, termed HIV encephalopathy or AIDS dementia complex. One major clinical feature of this entity is the occurrence of dementia, that is, fall in the cognitive ability of the individual compared to previous level. Now, progressive multifocal leukoencephalopathy. Progressive multifocal leukoencephalopathy (PML) is a slow viral infection of the central nervous system caused by a papovirus called JC virus. PML develops in immunocompromised individuals like cytomegalovirus and Toxoplasma encephalitis does, and it is therefore an important form of encephalitis due to increasing number of cases of AIDS. PML infect oligodendrocytes and cause progressive demyelination at multifocal areas scattered throughout the central nervous system. Microscopic examination, the features are as at first is focal area of demyelination, many lipid-laden macrophages in the center of the foci. Now, spongiform encephalopathy. Spongiform encephalopathy, also called Creutzfeldt-Jakob disease (CJD) or mad cow disease, include under the group of viral encephalitis, but is caused by accumulation of prion proteins. Prion proteins are a modified form of normal structural protein present in the mammalian central nervous system and are peculiar in two respects. They lack nucleic acid, DNA or RNA, and they can be transmitted as an infectious proteinaceous particles. Majority of the cases occur sporadically through familial predisposition without autosomal dominant inheritance, has also been reported in 5 to 15% cases. Other methods of transmissions are by iatrogenic route, that is by tissue transplantation from an infected individual, and by human consumption of BSE bovine spongiform encephalopathy infected beef, hence called a mad cow disease. Clinically, CJD is characterized by rapidly progressive dementia with prominent association of myoclonus. CJD is invariably fatal with mean survival of about 7 months after diagnosis. Microscopic examination. The hallmark is spongiform changes. There are small round vacuole in the neuronal cells. These changes are predominantly seen in the cortex and other gray matter areas. Fungal and protozoal encephalitis. Mycotic disease of the central nervous system usually developed by blood stream from systemic deep mycosis elsewhere in the body. They are particularly more common in immunocompromised individuals, such as in AIDS patients of lymphomas and other cancers. Some of the fungi which may disseminate it to the central nervous system are Candida albicans, Mucor, Aspergillus fumigatus, Aspergillus fumigatus, Cryptococcus neoformans, Histoplasma capsulatum, and Blastomyces dermatitis. These fungal infections may produce one of the three patterns: fungal chronic meningitis, vasculitis, and encephalitis. Besides fungal infection, CNS may be involved in protozoal diseases such as in malaria, toxoplasmosis, amoebiasis, trypanosomiasis, trypanosomiasis, and cysticercosis. This session is powered by Digital Version 2.0, Jyoti Vidyapeeth Women's University. I hope you all enjoyed this session. If you have any query, please mention it in comment box. Thank you.